Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined today by the chairman of the Council of the District of Columbia, Phil Mendelson, as well as members of my cabinet to provide a situational update. As you know, the chairman provides a briefing to the press before legislative sessions, and he is going to provide that briefing this morning and take questions. And then Dr. Nesbitt and I and members of my team will provide a situational update and then take questions. Chairman Mendelson.
Thank you. Thank you, Mayor Bowser. Good morning to everybody. So just to remind you, before legislative meetings, I have a press conference, and given where we are with the pandemic, what I did before the council's recess was when we had a legislative meeting, join the mayor with her press conference, makes it easier on the press. So that's what I'm going to do, is talk about tomorrow's legislative meeting, take questions if there are any, and then turn it back to the mayor to proceed with her press conference. I figure that this is easier on the press. You don't have to come over to the Wilson building and move around. And so the council is back from its recess, which was shortened this year, and tomorrow we will have an additional legislative meeting. That means not the regular monthly meeting. Because it is the first meeting since July, there are more measures on the agenda that are temporary in nature, what we call emergency bills, to deal with issues that we haven't been able to deal with since, or that have come up since July. Probably the most noteworthy of the emergency bills that we have is to extend the mayor's authority under the public health emergency through the year till December 31st. It's a very simple bill, and I say that because when we have in the past legislated with regard to the mayor's authority, we included in it a number of other measures, and those are continuing in nature, so we don't need to address them with the legislation tomorrow. The meeting tomorrow will be preceded by a committee of the whole meeting, and I should also note that the meeting tomorrow will begin, the committee of the whole meeting will begin at noon, not at 10 o'clock. And we're doing that because we are reinstituting the legislative breakfast that we have traditionally had before a legislative meeting, although it will be a virtual meeting, and that means members will have to provide their own breakfast, which they may or may not do, but we will have that meeting at 9, and then if there's any work that comes out of that, there will be time before noon to get that work done, which is why we are going to start the Committee of the Whole and Legislative meeting at noon. There are some bills being marked up in the Committee of the Whole. I don't think any of them are controversial, but if you have the agenda, you would know what they are. Renaming of Aton Elementary Schools after Lorraine Whitlock, declaring the official flying mammal for the district as the big brown bat, a measure concerning diverse fund managers for the retirement board, putting in permanent law the term requirements for UDC Board of Trustees members. Those are coming out of the Committee of the Whole. The other bills that might be worth mentioning, there's a budget support clarification, Emergency Act, which is to fix some issues that have come up since we adopted the Budget Support Act in July. It's fairly technical in nature, authorizing the Chief Financial Officer to go to the bond market for over $1.1 billion in borrowing. A couple of measures concerning evictions and rent control, one of which would, even though we're prohibiting the filing of eviction cases in court, the emergency proposes to prohibit landlords from issuing notices to vacate to tenants. If I sound a little uncertain about it, it's because I'm not clear if there's the need, given that landlord-tenant court is closed right now to eviction proceedings. I'm going to stop there and say those are the highlights. The council will meet again with its regular legislative meeting on October 6th. We are now approaching the end of council period 23. So I expect that over the next several months, we will see an increasing workload of legislative measures coming before the council, because permanent bills that are not marked up and voted on at this council period, during this council period, will expire and would have to be reintroduced next year. So I expect that at least until November, we'll be meeting every 2 weeks. And December as well. The only hesitation with regard to November is our schedule is adjusted because of the election and Thanksgiving. So we will be increasingly busy over the next several months, and I'm happy to answer questions if there are any at this point. Yes.
Thank you. Will you be voting tomorrow on moving forward on a Howard Hospital bill, or will you be waiting until that?
That's on the agenda for tomorrow. So I expect that we'll be moving forward with it.
Why not wait for the ethics review?
There's not a need to, there's not a requirement that we have to wait.
But to restore public confidence after recent Jack Evans, we have this Vega review with Rashad Young's involvement. Have you considered waiting to see what Vega says?
I would say, because this was in your question, that to suggest that the work that Vega is doing is of the same level or comparable to the concerns around Jack Evans. I think they're very, very different in the degree of the allegations. I'm comfortable with our moving forward, and I have not heard from any members about it at this point.
Thank you.
Yes.
I understand that your office has been thinking of decoupling emergency legislation to the public health emergency. I wonder if you've given more thought on what that could be over break, and when you could tell us more about that.
If I understand the question, it has to do with the fact that there are many, many, many provisions that we adopted on an emergency basis tied to the public health emergency. And some of those provisions have merit on their own without regard to whether we're in a pandemic, largely shut down. And so it's worth considering those on a permanent basis. I'm assuming that's what you're talking about when you say decoupling. Yes, we want to look at that, and we have begun to look at that, but I'm not sure that that would come up in 2 weeks. That'll be very time consuming. We're also looking at whether on some of the provisions, whether we should have different, what I'm going to call trigger dates or expiration dates. An example of that would be, for instance, right now the prohibition on filing any eviction cases in landlord-tenant court. If I remember correctly, that's supposed to end 60 days after the public health emergency. What we're hearing, but this is anecdotal, is that there could be hundreds, if not thousands, of pent-up cases that would be filed at once. And so maybe we need to look at that and what's the right way to avoid this huge tsunami, if you will, on the courts. So that would be an example of where we'd be looking at the trigger or sunset. But this is complicated because there are a lot of provisions. We need to think it through. So it's definitely under consideration, but I'm not sure it would even be ready in 2 weeks. I think I saw some other hands. Dorothy?
I wanted to ask you about two bills that are on the agenda for tomorrow. One is on page 5, number 5, General Election Preparations Temporary Amendment Act of 2020. And the other one is on page 7, Election Worker Residency Requirement Waiver Emergency Declaration Resolution of 2020. The first bill, the General Election Preparation Temporary Act, is that going to be virtually the same bill that was passed at the last session of the council, or are there going to be any amendments? And if there are, do you know what they'll be?
With regard to the first, that's a temporary bill. And for those who don't follow the arcanery of the council, we have emergency bills that last 90 days. Temporary bills accompany them and require 2 votes and last for 225 days. This is a temporary bill up for second vote. It would be identical to the emergency. If there are amendments, and amendments would be in order, then it would not be on consent. So I'm not aware of there being any amendments to it. It should be identical to the emergency. With regard to the other bill, which is on page 7, the election worker residency requirement, my recollection is that bill enables the board to accept the mayor's offer of a number of DC government employees who would assist at the polls, and they wouldn't necessarily be residents. And that's what the bill would permit.
Does it also apply to non-DC government workers who are not residents of the District of Columbia?
I don't know. I don't think so. Let me see if I can find a little bit more information on the bill. This is what Mr. Allen, who's moving it, said. Under current law, election workers must be qualified registered electors, meaning they must be district residents who are registered to vote. The executive has offered to deploy district government employees to the board to support the administration of the election. However, some of these employees may not currently reside or be registered to vote in the district, making them ineligible to serve as election workers. This emergency legislation allows the board to utilize district government employees deployed by the executive as election workers, regardless of their residency or voter registration status. So that doesn't answer your question clearly, but it makes me think it only deals with district government workers.
Is there any reason why it should be so restrictive? The problem that this is trying to surmount is the fact that under current DC law, only DC residents and voters can be poll workers. In their need to recruit poll workers, there are a number of people who've stepped forward, but then they're not DC residents. Why pass legislation that's only going to enable non-DC residents who happen to also be DC government workers? Why not just temporarily suspend that provision?
I believe that no need for that has been identified
From the board?
from the board. In fact, in a call that the mayor and I were both on last week, the board indicated that they have over 4,000 poll workers, and the mayor's offer, which I can't remember, it's over 1,000.
2,000.
2,000 would be in addition to that, and their need, they say, is about 4,000. I think I saw another hand, yes.
Chairman Mendelson, if I could ask about something that's not on the agenda for tomorrow, but there is a group that is working its way with legislation that they would like support from the council called the Music Venues Relief Act. And it specifically goes to provide financial support for venues who depend on live audiences, which are not able to open under the current restrictions. They say they have been engaged by Sean Townsend and the mayor's staff and a few of the DC council members, but they have not heard back from your office at all. And I'm just wondering, is this something that you support? And do you think that there is relief that the council and the government can provide specifically to these venues that were first to close, will probably last to open, that, you know, they're not restaurants, they only have ability to offer things to live audiences, which they can't do now?
I absolutely support trying to help the musicians and to help the music, to live venues for musicians. However, and I'm not speaking specifically with regard to this legislation, when the pandemic first began, the council voted $25 million to help local businesses. And since then, we've approved legislation that if funds are available, an additional $100 million for businesses in the city. I think we need to be careful that we are not picking winners and losers among businesses to help, because there are quite a number of business categories that need assistance. Child care facilities come to mind as an example. And so while there's no question but that the music community's been hurt by the shutdown, child care facilities have been, really small businesses, restaurants, I mean, it's a list, and they each are unique in their way, but they all share the same a challenge, which is that the business has gone away. And so I think it would be a mistake to single out music venues above others, but rather to ensure that through these programs that they get assistance as money is available. Sam?
Hey, Mr. Chairman, I saw a piece in the Post last week that sports betting is not bringing in the money expected. Obviously, there have been sporting events, but they're suggesting that people apparently will get a better deal betting elsewhere than with the city. Just curious if you have any comment or interest in it.
Well, I actually, if your question is based on that article, I had a comment in that article, and the comment was that I think it's premature to say that the approach that the city has taken is a mistake or went wrong. Basically, we offer people a choice. They can bet through private venues, and if I remember correctly, there's, I think the odds are something like 95% winning. I hope I'm not wrong when I say that. Or they could bet through the cities, through the lottery, and the odds there are a little bit lower. The return to the city, betting through the city, is greater than the private sector. What I have heard is that some of the private sector businesses are the source of the criticism, probably because they don't like the government in that space. And they suggest that it would be more lucrative to the city if we gave up the lottery. But that I checked and double-checked that with the CFO, and it's too soon to say that that's correct. Based on the data to date, it appears not to be correct. There's no question that the revenues that were projected are lower, considerably lower than what had been estimated a year ago, before there was a public health epidemic, before everything shut down. And also before, I think there was a court case a year ago that slowed things down. So the reduction in revenues is not as a result of it being a poor plan. The reduction in revenues is based on all these other situational factors. But with regard to the private versus the public betting, it's not clear at all that the competitors are correct that the district's approach is unprofitable. Mr. Rice.
Can you tell us where we are with the archives advocacy group?
Yes, I had hoped to make the appointments a week ago, and I haven't, so they're on the list, top of the list, after tomorrow. Mr. Seagraves.
I'm wondering if you have talked to the CFO's office and if you have any insight and what your concerns might be about two reports that we're anticipating. One, the updated revenue projections once we know about property tax payments and that, and also the stress test on the unemployment insurance fund. Both of these are pretty critical financial reports that will be coming out, I guess, within the next weeks or month. And I'm just wondering if you have gotten any preview, if you can give us your thoughts or concerns.
I don't believe I have any good information with regard to the revenue estimate. It's coming out September 30th, and I'm looking at the mayor because I don't think any of us know what that revenue estimate is going to show. I think it's going to show that the economy is not recovering as quickly or as fully as the CFO had estimated in April. That was the last revenue estimate, so that there will need to be some adjustment to our budget. And we're prepared to move forward. I think I can say that collectively, we're prepared to move forward in October if we have to do that. The economy is coming back, so that what the CFO had suggested in August, which was there could be as much as a $500 million reduction in revenue, additional reduction, may not materialize. With regard to the second report, unemployment insurance, I have heard from the chief financial officer that it's likely that we will have to look at adjusting the tax rate for unemployment insurance. You know, the city we have not been reticent about making unemployment available to workers who've lost their jobs due to the coronavirus. And we created quite a bit of flexibility back with our first legislation in March. And that means that we are expending the unemployment insurance fund very quickly. And so it's reasonable to expect that that fund will need additional revenues and that there'll have to be an adjustment that we'll have to consider.
And so, can you inform me, like, who is that tax on? How does that work?
That
and
tax
how
is
much
on
do we-
businesses,
It's on businesses?
yes.
And so do you have an anticipation of how much it might go up?
No.
Do you know, Virginia has said that by October, they may have to borrow money for their unemployment insurance fund. Do you know if that's the case for DC?
I've heard something along those lines, but not as early as October for the district.
You've heard from the CFO
I believe so.
that the district may have to borrow money at some point? to
I don't want to go too far with that because you're testing my memory, and although my memory is very good, just want to say, I can remember video and what are the other three words? I don't,
I think the way to say it, Phil, is that if we have to deal with the unemployment fund, that we have to plan for worst-case scenarios to address it. And that's as far as any of us have gotten, I think.
Do you know a date that you might?
No.
Is it possible you might have to start borrowing money?
Like I said, we will lay out like worst-case scenarios to make sure the fund is solvent.
let me just say that when you mentioned borrowing money, my understanding is that states can go to Treasury, U.S. Treasury.
Correct.
It's not that they're going to Wall Street to borrow.
Correct, yes.
Yeah, there's a mechanism that's part of the unemployment insurance program. Maybe a couple of questions, and then I need to turn it over to the mayor. Yes?
All right. Well, speaking of planning for scenarios, Justice Ginsburg's passing, there's an ACA case coming up to the court in November that it now is looking much more likely that the ACA could be overturned, and I wondered whether DC was putting in any planning for that, whether that affects the pending Medicaid contracts or any other plans you might have.
I can only speak for the council, and I would say at this point that there has not been any substantive planning yet. Dorothy?
One of the major bills on the agenda for tomorrow that's on consent, but is for final reading, is the Vision Zero Enhancement Omnibus Amendment Act. It's a very long bill. I think it's more than 31 pages. Have you heard or are aware of any efforts to amend it?
I've not. That's why it's on consent. I'm not aware of any amendments to it at this point. I'm going to turn it over to the
Thank you,
mayor,
Mr. Chairman.
but I'll be here for a while, so if there are more questions at the end of the press conference. Thank you, Madam.
Thank you, Mr. Chairman. And we have a bit of a longer briefing today, so I want to get right to it. And we talked to you last week about updating the publicly available information on the coronavirus and our progress towards phase 3. So I want to ask Dr. Nesbitt to talk about that as well as talk about where we are with contact tracing and to give you a few examples of how we are working with that.
Thank you, Madam Mayor. You all are familiar with the previous page snapshot, which are all of our metrics in today. We have updated the dashboard that is available on coronavirus.dc.gov. Before you see a new visualization that presents all of the metrics, including a color grid that shows at the top the current status of the phase that we are in. Phase 2 is indicated by the color yellow. So for each of the 4 categories that we have, community spread, health system capacity, public health system capacity, and community engagement, you can follow where each metric currently sits in terms of its phase. For the current phase, yellow, that metric is only being satisfied for that phase. If the metric is green, it has met what we have set out to be the criteria for moving into phase 3. If it's red, then it is meeting the criteria for phase 0 or 1. So that's how you should be oriented to this grid. We encourage people to look at coronavirus.dc.gov. There is additional information that helps you understand why. Looking at each of these categories is extremely important, and additional information for each metric. On the next slide, you'll see just sort of a pattern here that shows what the thresholds are that DC Health looks at for making recommendations for moving and transitioning between phases. It must be sustained for a period of time, so we encourage people to have that in mind and not to focus on, oh, it's been met for a single day, we should transition back and forth between phases. And it works by in both directions. So if we hit a level that is of concern, we would like to see or would be monitoring to see if that level of concern is being sustained before we would make recommendations that non-pharmaceutical interventions or these community mitigation strategies, as we talk about turning our dial up or down, we would monitor to see if those changes in any direction have been sustained. When you go to the website to look at the metrics, you will see some of the other trend charts have been updated as well, showing you the lines for each of the phases. So you'll see what in the category for hospital capacity, you'll see where we have the trend line set for what we consider to be sufficient, insufficient, moderately sufficient, and sufficient hospital capacity, and what each of the benchmarks or thresholds rather are for phase 0 and 1, phases 0 and 1, phase 2, and phase 3. And you'll see what those trends have been over time since March to now to help you be able to follow along with the district's progress consistent with our update on Friday over the past 6 months and where we are now. In terms of contact tracing, we have some very important things that we want people to be sensitized to. It's really important if we want to make progress on our contact tracing metrics that people answer our call. We do appear on caller ID as the DC COVID-19 team. It will help us contain the virus. We want people to know that you stay anonymous, and it's a part of a social good that helps you protect your friends, family, coworkers, and neighbors. We do want to emphasize that the contact trace force will never ask you for your immigration status, your social security number, or any other critical information related to bank account details or credit card numbers. But it's critically important that you answer the phone when we call. We have introduced a home visit pilot program, and people are eligible for this program if we have missing or incorrect phone numbers, which we find for about 3 to 4% of our positive cases. If we have reached the person by phone at least once, but the investigators were unable to complete outreach or to implement public health monitoring, or if the individual has been identified as having complex needs that would be better met in person by their healthcare provider or the community health providers who offer them services. Some initial results from our home visiting pilot are presented here. 71% of the people who have received home visits or were identified for home visits are positive cases, whereas 29% were close contacts of positive cases. 43% of them were within the age group of 20 to 39. So the largest group that we identified to receive home visits were in that age group that is now contributing to the largest proportion of cases in the district and actually in the U.S., followed by those 40 to 64, age 40 to 64. And you can see that those 65 and older actually are the largest age group represented in our sample. Similarly, Spanish speakers represent about 17% of those who were selected for a home visit pilot, and English speakers represent 83%. We also have the ward breakdown here for you as well. On the next slide, we present some information in terms of the home visit pilot outcomes. Of the 139 cases, or 135 cases that were identified for visits, 55 interviews were completed, which is 40% of those. And those interviews were completed either on-site or within 1 to 2 days of us reaching them. We had about 80, which means we had about 80 individuals who we could not reach successfully. But within that information, that was very informative and telling as well, and it helps us to inform our community partners who have received grant funding from us and the healthcare provider community that refers individuals to DC Health for public health monitoring and outreach. Of concern for us are the positive cases, the 16 positive cases and the 1 close contact who, when we went to the home, we were told by people in the home that they were not there isolating or quarantining. So these are individuals who are positive for COVID and are not adhering to the requirements to quarantine and isolate, which continues to put other individuals at risk. We also were able to identify that we have invalid or wrong addresses. Some places there is no physical building or actual address, which helps again to work with the community partners who have been resourced to really work to make sure that that information is accurate. On the next slide, we want to just spend some time highlighting why home visits actually have benefit and why we will continue with this approach. For the first one that I will share with you, this was an individual that was identified for a home visit because they had an incomplete interview. During the home visit team was informed by the positive case that they had actually blocked the contact trace force number due to the number of calls they received. During the process of the interview, the home visit team was able to complete the interview and provide resources. A follow-up public health monitoring visit was conducted to confirm delivery of resources and conduct the interview. And due to the home visit, this case was able to complete a full interview and obtain necessary social support resources that they needed. Without the home visit, this case would have been considered lost to follow-up and would not have received the essential resources that the district government provides to help individuals successfully isolate in their home and reduce the risk of transmission for COVID-19. On the second case study, the reason for this visit was a missing phone number. During the home visit, this was the first time that the positive case was notified of their positive test result. The case was visiting the district to take an exam. The person had traveled from their home country, was tested in the district, and had no local phone number. The case did not know they were positive and was staying with an aunt and an uncle. The uncle was immunocompromised. Based on the information that they received, noting that this individual was positive for COVID-19, the family made the decision to have the individual receive support from the district government to isolate in one of the locations that we had, and they to reduce the risk of exposure to the immunocompromised uncle. Because of this, the home visit team made the necessary linkages. The case was successfully isolated during the required period of time and has been extremely grateful for the support. They have now since returned home, and the individual it did not continue to compromise their family members and has reduced the risk of transmission within their household and risked the likelihood of severe illness for a loved one. The third case study was selected because of an incomplete interview. Although we have received information from a healthcare provider that this individual has tested positive for COVID-19, the positive case has consistently denied that the authenticity of the test result associated with their case file. The case has emphasized that they have never been tested and that they also have not been to a medical facility and therefore could not have knowingly been tested. The case has refused to comply with recommendations for isolation or disclose contact information to us. This individual works as a staff person for a building in which they reside. So as a result of this, DC Health is providing intensive monitoring and guidance to the building for possible new cases and other social distancing measures. So those are just some examples of how home visiting can provide additional resources and public health measures to our community.
Thank you, Dr. Nesbitt. So let us talk about another very important aspect of our public health, and that's the flu vaccine. We have for several weeks been urging residents to get their flu vaccines. And today we are pleased to announce a new partnership with Walgreens that will make it even more convenient to get your flu shot starting today through Friday, October the 2nd. Monday through Friday, 8 a.m. until noon, Walgreens pharmacists will administer flu shots at Judiciary Square. Most insurances cover the flu shot at this site. This is our F Street site, correct? At Judiciary Square, our testing site. You are required to bring your insurance card as well as a government-issued ID. Residents without insurance can find a list of clinics where they can get a flu shot by going to dchealth.dc.gov/flu. We want to stress that the flu vaccine is safe. It will not make you sick. And even if you got the flu shot last year, you need to go again this year. And the flu vaccine is for everyone who is 6 months old or older. It is important every year to get a flu shot, but especially this year. Getting the flu or getting COVID can cause serious illness, and we know that catching both at the same time can make you very ill. I also want to turn to Deputy Mayor Falchicchio. We made an announcement yesterday about additional support for one of our hardest hit industries, the restaurant industry, in preparation for winter. John?
Thank you, Mayor Bowser. So yesterday we announced the Streetery Winter Ready grant program. This is a $4 million grant program which will provide a one-time grant to restaurants who are operating as a streetery who have a summer garden. So basically, any restaurant that has outdoor dining will be able to apply, and we are limiting it to restaurants that are locally owned or have a majority of employees, that are DC residents. This is similar to the criteria that we had with our partners on the council when the mayor announced the microgrant program. But this program, the $6,000 can be used for the purchase of equipment such as tents or heaters, whether that's the purchase or the rental. And it could also be used for other soft costs like marketing or advertising the streeteries for your customers. So that's what we have teed up. Businesses can begin to apply today by going to coronavirus.dc.gov /recovery-business or just go to the coronavirus.dc.gov website, and you can find more information there. We'll start reviewing applications on October 1st and start making grant awards thereafter. And all grant awards will be for the $6,000 amount. So, Mayor, that's what we have for the Streetery Winter Ready Grant Program.
Thank you. Thank you, John. And finally, the deadline for the census is upon us. It's Wednesday, September 30th. you need to complete your census questionnaire. You can go to 2020census.gov. You can also call the numbers listed in English and in Spanish. It's a very, very serious thing because the federal dollars that do flow to the district are based on the number of people who live here. So we need everybody to respond. Okay, we'll take your questions. Mark?
Dr. Nesbitt, if we could talk about the new dashboard and specifically page 4, I just want to understand, are these the metrics that we're looking for now for when you would be prepared to signal phase 3, this list of phase 3 green column?
Yes.
Okay, and just so that I'm on the same page, is this the first time we're seeing metrics for phase 3?
We had previously on a dashboard, so thank you for asking for clarity. On the dashboard, we have always had metrics with the thresholds of what we were looking to see. And we've always made it clear that it's a holistic approach and we have to have both a quantitative and a qualitative approach to decision making. What became, I think, a challenge for many people is that we are looking for a sustained decrease in the number of cases, but we're also looking at things related to the capacity in our system. We're also looking at the degree to which people are engaged in different processes. And so even with a sustained decrease in cases, if we are not able to be responsive and to new cases and to quickly respond to any outbreaks, it would not be responsible to move into different phases. And so we wanted to be able to have people understand what we are looking at internally to help inform what those decisions are. And so we're putting out the metrics that we have been looking at internally to help people follow along externally. So there have always been metrics on the dashboard for phase 3. We had not met those metrics. So even though we retired the metric we were using for community spread, we had not met that metric for phase 3. The new metric that we have on the dashboard for phase 3, we aren't meeting that one yet either. So yes, these are the metrics that we are following. Over half of them are not new. And there are new ones that we have been looking at when we talked about the quantitative things that help put together a good picture of how well we would be able to respond to outbreaks and clusters. We've now put some things out there to help people follow along to see where we're going.
And so when I look at that chart that is up right now, that doesn't change, right? That's not anything that's changing daily. Those are the metrics that you have for phase 1, 2, and 3 and corresponding in red, green, and yellow, correct?
So we have something on the dashboard that will say to you that the metrics can change and thresholds can change. And what's important for the public to know, like for example, when we started looking at test positivity 3 months ago, we had a threshold that was a lot higher. And that's because the best evidence that was out there from countries who were in a different place in their response suggested that if your test positivity was at 10%, you wouldn't have a second wave. We now know that you need to have that be below 3%. So it would be irresponsible of us to leave that threshold at 10% if we now know that there is more evidence out there that says that threshold should be below 3%. So I would not commit to never changing the threshold of a metric if I know that the public health science from both how the virus itself behaves as well as what community mitigation strategies are being the most effective in other communities.
I appreciate that. I think I asked my question wrong.
That's
what I meant
okay.
to say is if I look at page 3, these are the metrics that would change daily, right? These are the things that you update daily and
Yes.
change daily, and people can kind of see the progress. And if these red, green, and yellow boxes on the daily changing chart correspond to these red and green boxes,
That's correct.
right? So if I see that I'm red here, then I'm in phase 1 for this one indicator. I'm in phase 3 for this one indicator.
That's correct.
Is that
And,
fair?
and you'll
Okay.
be able to click on the website and be able to see the trend line for each one of those, to see if
Okay.
it's going up, if it's going down, if it's moving in the right direction. Some things should trend upward, some things should trend downward. And the website will help you understand which one should be moving, and if going up or going down is positive or negative for each metric.
And then my last question, I appreciate your patience.
That's okay.
So if I'm following along on this chart that you're showing right now that is going to update daily, do I need to wait until all of those boxes are in green before we would see phase 3 triggered?
Yes.
Okay. And then, I said it was my last one. On the very bottom, there's 2 boxes that don't have colors around them. Why is that?
So the boxes
Or
that.
there's actually 3.
Yes, so there's and I need to amend my response to that previous question. So rate of transmission, when your cases get low enough, then it loses its value. So its usefulness is probably the best way I should say it. So that one may not turn green, the rate of transmission, okay? The ones that are gray don't have a specific range that we are looking for. That's why they don't have a color. So we just want to see if they're increasing or decreasing. So we'll
They'll
be
never have a
monitoring for
color.
that. Pardon?
They'll never have a color.
They won't, right.
Thank you very much.
Yes, Julie?
Yes, I really appreciate your explanation about changing the metrics as public health information changes. And I was wondering about specifically the hospital utilization. We've heard for months that we had to be below 80%, and now I see that phase 2 is now 80 to 90%.
Right.
What changed? What do we know now?
Right, so with that one in particular, and the district has a little bit of unique nuances around it. And so while in a phase 3 environment where we're going to be looking at the capacity of our system without surge, and that's how we define that one, the district sits at 80% capacity on a regular basis, pre-COVID. And so in a COVID state, where we have built additional capacity within our system and capacity at the alternate care site, we made a conscious decision that as we are looking across different phases in terms of what we want the capacity in the system to look like without surge, and taking into the consideration the policy decisions we have made as to what we would open first, the ACS versus the internal capacity in the hospital, flexing for ICU beds versus the acute care beds, that we could have in a phase 2 environment. And because this has been happening in the phase 2 environment, 80 to 90% range without compromise to patient safety and quality in the acute care environment. And so the goal of having it be sustained below 80%, we could adjust that to be for a phase 3 goal.
And are there other, that one just jumped out at me, are there other metrics on here that we've actually made it easier to be in phase 2 that we should be aware of?
Well, again, it's not a function of easier to be in a particular phase. It's the function of what the public health science has told us. And the example I gave Mark was a harder threshold to meet, right? So the test positivity prior to, we were setting them at 15, 10, 10, and 5. And now we know that in order to have a sustained response and reduce your risk for second waves, rebound, et cetera, you really need to be focused on test positivity being less than 3%. And so we've made those types of adjustments accordingly.
Right, so I shouldn't have said easier, but are there others on this list?
Like test turnaround time, we've had a lot of those conversations nationally in terms of what's ideal for test turnaround time. We really focused on less than 48 hours. There's still conversations that we're having nationally around some community engagement metrics that we haven't really solidified. We're looking at what adherence or compliance to masks look like, but there's no real good way to measure mask adherence, and so we're having conversations about how to do that.
Thank you.
Yes.
Dr. Nesbitt, you said that residents could follow along. Right now, the image of our metrics is static on coronavirus.dc.gov. So should we expect, say, in the coming days, to be able to today, like daily case rate today is 7.4, and then we'll like be able to kind of track and follow? Will we have access to underlying, like the data is my question. As we do
I don't follow your question.
So you had, okay. The image, this image right now on coronavirus.dc.gov is static. It's a static image, meaning you cannot click and follow along, right? So are we going to be able to?
Do you see a trend line yet on that website?
No, so I
Okay,
guess, so we will
Yes.
eventually.
yes.
Okay, just clarify, thank you.
Uh-huh.
Yes.
I think it was said in an earlier news conference that the city might meet certain metrics, but that we might not necessarily move into phase 3. So just to clarify, you're saying that that is different now, that it has to be all of these green met, and then I have a follow-up question.
Yes, I think that's what we said. And keep in mind, previously, we also talked about the number of activities that remain to be turned on in phase 2. And we will work towards doing that.
So to follow up to that, the one in the red here, the metric of positive cases interviewed, that is something where it involves, participation from the public, but also city employees going out to meet these people. Is there an issue of maybe more employees need to be hired? What happens if this metric doesn't move and everything else goes towards?
Well, it's going to move. It has moved. And it will continue to move. But it is, I think you point out rightly, that we can have the best system, but we need participation. We need, I call it compliance. Dr. Nesbitt calls it community engagement. But we will continue to work towards getting the compliance that we need. And you've seen already when just the phone calls didn't work, we added our staff going out to do the home visits. And we will continue to work for strategies to get the number up where we need it. Yes, James.
Dr. Nesbitt, you talked about phase 3, and I'm gonna kind of dovetail on what Mark asked you about phase 4. Because we are where we are now, could you talk about what it will take to get to phase 4? Because there is talk that in mid-2021, a vaccine could be available. When this vaccine is available, is that a mechanism to move to phase 4, not respective of the metrics that you just presented here?
You jumped all the way to phase 4, James. So everybody just wants to get to phase 3, and you move all the way to phase 4. So, but it's a great opportunity to highlight that the availability of the vaccine itself is not the solution. It's the ability to have good uptake of the vaccine by the population, which requires a tremendous amount of trust in the vaccine. People have to understand that it is both safe and effective, and that it is going to be widely available. And so this conversation that we're having internally, and that we're going to be pulling on some strategic advisors to be able to assist with that, is how well of a job we're going to do as a community to getting people to understand that the vaccine that becomes available is both safe and effective. It will be difficult to move past phase 3 directly into a phase 4 because you have to still get your case rate down through some of the mitigation strategies prior to when the vaccine will be widely available to the general public. So after the vaccine is determined to be safe and effective, only a small number of doses will be available to the community. And it will have to go to priority populations. So we are still going to have to heavily rely on our non-pharmaceutical interventions. So wearing a mask, washing our hands, staying home when we're sick, and responding very quickly to outbreaks that happen in clusters, congregate settings, wherever they may be. If we don't do that, we're gonna still have high daily case rates or high test positivity, all of those things that help us to categorize ourselves in phase 2 and phase 3, and may have to dial up or dial down accordingly those community mitigation or strategies that we have in place. So that's why those other categories will still remain relevant until we get into that phase 4 sort of like post-COVID, post-vaccine available state. Because the ramp up of vaccine availability takes a while until we can get to everybody in our community.
Yes, Lou?
I guess maybe a quick off-topic question, if
Sure.
I could. You played a very active role several years ago in promoting DC's bid to be the host city for the International Gay Games.
Mm-hmm.
And as you know, the organizers selected Hong Kong over DC and Guadalajara, Mexico, the 2 finalist cities. But the Federation of Gay Games, who puts those on, announced last month the 8 cities have submitted bids for the 2026 Gay Games, and DC was not among those that submitted a bid. Did you play some role in deciding whether DC should not submit that? And if so, is the city's bid for the World Cup soccer in 2026, did that play some role?
It did not, and we joined in. We weren't in the lead in the bid, but a very diverse and energetic and very capable group came together for our bid application for the Gay Games. I went with the group to the presentation, and where were we? Paris?
Paris.
We were in Paris. And we had the best presentation, I just have to tell you, and I think the strongest application by far, and not even close. But as you know, sometimes other, considerations are made for the award of the games, and Hong Kong was awarded the games that time. So I gathered that the team may have wanted to put it together, who have been part of the bid process with this organizing body before, may have just wanted to take a pause on it. But that and going for the FIFA for the World Cup, they're not connected.
I see. Maybe one quick follow-up. What some of the organizers have said, not officially, should there be some problems with Hong Kong, we know that Hong Kong is facing a lot of issues, then if for some reason they could not be the host, the tradition or the policy has been one of the 2 runner-up cities might get it. Could you say that DC would be ready to do that if that happened?
I would say yes. And again, I'm now pulling from my memory of the venues and the various things that we put together in response to it. But we were tapping into a lot of existing infrastructure. So I would have to go back to the plan, Lou, before I could say that with certainty. But even in the constrained times of COVID, I think that plan and that application really relied on a lot of existing infrastructure. So let me check into it. Yes, we'll go to Stephanie, James, and back to Mark, and then we'll wind up.
Mayor Bowser, can you please explain the complication with Black Lives Matter Plaza, the street mural, the Federal Highway Administration, and complaints from businesses there, and what actions or conversations you have had about this?
What complications? What do you mean?
There's a report from one of the local news stations that businesses, including the hotel, AFL-CIO building, right where Black Lives Matter mural is, that they are complaining about the business. They would like that street to reopen, but Federal Highway Administration rules they cannot do so because the mural is there. That mural would have to be removed.
I don't know if I would agree with that characterization, but certainly over the last several weeks that the street has been open to more traffic, and we expect it will be open to more traffic.
Does that mural have to, can you explain, will that have to be removed in order to do so, or what the conversations have been about?
Already, it's been open to more traffic in the last several weeks, and so we will continue to work on a plan that is long-term for more traffic to be open on the street with the mural.
And who does that involve when you say working with the plan?
I'm sorry?
What entities, who are you working with?
We're working internally.
So no Federal Highway Administration involvement?
I mean, I answered your question. We're working internally. James?
Mayor Bowser, just for the record, is your administration in consultation with both of the major campaigns for president in terms of inauguration activities? I want to know that because if the Democrats should win, that will be a historic achievement, and there may be more people interested in coming to the district for that event, should it be that way. Again, has your administration been in consultation in terms of the inauguration?
Yes, and as we reported, the process, the way it works now, James, is that it is not political. So that the district works with the Secret Service. In the Secret Service, we started that process and have had those initial meetings already. And then once there is a president-elect, they appoint a pick, right? The Presidential Inauguration Committee. And then that's when the president-elect has his people, in this case, that are starting to work on the programming. And then they will normally appoint an organizer that represents the president, and it may be the party. The last time we worked with the PIC, and we worked with the organizer for the event. I met with them at the Wilson Building, and that will likely be how we will proceed in this case too. Mark.
Two questions. One, following up or closing the loop on this, Dr. Nesbitt. If you were to say tomorrow reach green for all 10 metrics for phase 3, how long does that need to be sustained before we would go into phase 3? And do you have any idea, I mean, is that weeks away, months away?
Typically, in the public health community, we like to see things happen for a couple of weeks. And that is informed by the fact that when a major incident happens or a major event occurs, you can see the impact of that 2 weeks later. So when a single day of change can be undone by a single event on that day. So we'd like to see that if we've made progress or there are some positive indicators, in order for it to be interpreted as real, that it be sustained for a couple of weeks.
And so do you have any idea how long away that is? Is it weeks away? Is it, I know you don't have a crystal ball, but.
We're not meeting them all today, Mark, so it's not gonna be today, right?
And then Mayor Bowser, can I ask you, you've mentioned at your last press briefing and again here today that you're looking at turning some phase 2 activities on that still have not been turned on. Your staff has indicated indoor swimming pools is one of the things you're considering. You're also looking at some of the waivers from the past. Can you be a little bit more specific and tell us what types of waivers you're looking at and what types of activities that you're at least considering and what there might be a timeline for those?
I think that, Mark, we are considering more indoor activity at our facilities, and that includes pools, it includes parks, and it includes libraries. So those are on our agenda. We had previously talked about more in-person commercial activity as well, and in fact, we collected some waivers at the time. So I think that would be the next group that we would look at. And I think that this is within the next 2 weeks activity to review and to make some decision.
So the waivers that were made public in the past that were not ruled on, I think the majority of those were all for live music venues that we're asking. So are those the ones that you're reconsidering now when you talk about indoor commercial activities?
We would look at that group, yes, for additional activity. Yes, yes.
In light of the winter streetery program, I'm wondering now if any aid is coming down the pipeline for restaurants and other businesses that don't have outdoor spaces. You know, so we don't create more winners and losers.
We don't have any other business programs that are outside what's been considered already and voted on by the council. That is pending funding. Yes,
Just hopefully a quick question for Dr. Nesbitt.
that means keep it short, Dr. Nesbitt.
The man who you described who said he never had a coronavirus test and wasn't going to isolate or get tested again or anything, can you tell us what you're doing to keep other residents of that building where he works safe? Are they aware of this issue in their building?
The management and leadership of the business is aware, and they have to put preventive measures in place. We cannot validate beyond the clinician saying that it was the person and the person saying it was not them. So, and we don't disclose the identity of the person. So we have to work to put preventive measures in place.
But you can't
For
tell
the
people,
individual.
hey,
Pardon?
someone in this building is not isolating, you should watch out if you live in this building.
No, we have not done that. Thanks.
Okay, last two. Yes, Sam.
So I hope I'm not being repetitious, but we're about at a milestone, about 6 months after we started this process. And either for the mayor or for Dr. Nesbitt, I'm just curious, how much better off are we in terms of dealing with this thing than we were when you started?
Well, thanks for that question, Sam. And we talked a little about this last week, looking back on our cases, what we thought it might be like, and where we are today. And certainly, we have many, many fewer cases than we thought we could have if residents and businesses hadn't been so diligent about following the public health advice. So still, we're over 6,000 DC residents who have contracted the coronavirus. I'm sorry, we're over, let me get my numbers right, we're over 14,000, almost 15,000 people who've contracted the virus, and 621 people have died. So we've lost too many people. The prevalence in the communities that it's most affecting, with over 70% of lost lives being African Americans, and we know how much this virus has shown disparities in our communities. At the same time, the sacrifices that our residents and businesses have made have allowed our public health care system to be ready and to be able to accommodate people who come in sick with COVID or with other illnesses. We've also built some resilience in our government. I couldn't be prouder of the people that work for us, who've turned on a dime, modified government operations, set up testing facilities, set up online learning, set up food distribution sites and isolation sites that have kept our community safe, who have worked behind the scenes administratively to make sure our receipts are into the federal government, so we've already started getting reimbursements back. So I am incredibly proud of the work that the DC government has done. I'm grateful to the members of the council who have worked hand in hand with us to make sure that the legal and regulatory frameworks are in place to allow for this unprecedented emergency operation. So if you ask us if we're better off in terms of being able to respond to this emergency and emergencies in the future because of the resilience that we've built. We've also built, I think, but there's work to do on a stronger infrastructure. For example, our kids have the devices that they need, but we need a stronger infrastructure for having high-speed internet access. We know that. We know we have to bring our economy back. People have shuttered their businesses, lost their livelihoods, and they did nothing wrong. It's just that this COVID attacked us, and we need to be able to help them come back into a stronger economy. So 6 months into this, we're all kind of sick of COVID, if I can speak for 700,000 Washingtonians, and I'm sure our fellow Americans, but we know that we have to continue to be vigilant. Yes.
I've got a question for John.
Yes.
John, this is obviously on what you just announced. Can you talk about how many business owners you anticipate will be applying for this? And also, we're just seeing some quick comments online of people criticizing, saying that with what restaurant owners have already lost already, and what they're not getting in revenue, paying employees, that this is a one-time deal that's not enough. How do you respond to that?
So we know that there are about 600 streeteries in the district. There's also about another 600 summer gardens, which are restaurants that have regular outdoor seating. And so for this grant, the idea is that we've heard from operators that throughout the pandemic, so over the last 6 months, they've had to make 2 or 3 different pivots to their business model. So they probably shut down at some point. They opened back up with a delivery model. Then they thought maybe about doing meals for families and selling that product. And then they started to bring back outdoor dining, followed by indoor dining. So their models have changed at each, or a couple different times throughout the pandemic. And so what we know is that with the cold weather coming, that they'll need some support for this new model, which will be outdoor dining, which will have probably tents, which will have heaters in the public space. So these streeteries are all in the public space. So in addition to this grant program, we're also allowing them to use the public space without charge. We're also waiving permit fees from DCRA and the fire department. And we're also providing this grant in order for them to get the equipment that they need to keep the business open. So we're trying to provide as many different supports as we can so that the businesses can be successful. And would we all like to be back inside at the tables and filling up their restaurants? Yes, obviously, but the health conditions don't allow that. So this grant program, through the Mayor's Office of Nightlife and Culture, will allow them to keep the outdoor dining that they have and grow upon that. So that's why we're excited about this program, and we think that there will be really good utilization of this grant program.
Okay, thank you, everybody.